There have been a lot of developments in our city, both politically when it comes to COVID-19 and even with the last story that we just showed. So it's been a couple weeks since we've had him on. We re-welcome Mayor John Tory to the show here on BT. Good morning to you.
Good morning, Mel.
Thank you so much. Hopefully you had a nice couple weeks off. I know it's been very busy, and I just want to thank you again for always being available to us because there are so many questions that Torontonians have. So thank you for that.
Happy to answer them.
Yes. So I actually want to go back to the Toronto police reform. So some of these recommendations that we've seen, again, 36 of the over 80 that have been completed. I know it doesn't happen overnight. Can you comment at all about what has been done and what is on the way?
Well, I think the parts that were done were things that could be done more quickly. For example, huge increases in transparency in the budget so that people will see line by line how the police spend their money. You mentioned the mobile crisis intervention teams to expand dramatically the coverage that those teams have, which are teams that include a nurse and a police officer or a trained medical person to help deal with mental health and distress calls, is a big accomplishment. The things that take longer are, for example, the establishment of a completely alternate way to answer calls from people in distress. So it's not the police that are answering, it's trained mental health professionals. And we're working on that and introducing a pilot project on that in January. But it takes time to get the people to decide how and where and when you're going to do it and so on. And so we're working at, I think, pretty good speed to get those things done. And I will say this. I am very committed to these reforms happening. It is going to take time to restore trust in policing and to try to do things differently. And in the meantime, I think that the police are doing a good job to keep the city safe, which is their task that they have, a very big task in front of them, and that we're working through this list. I think, to me, after a year, 36 out of 81 things that are completed is not bad. We can always do better, and we're working hard to make sure we get this done as quickly as we can.
Okay, let's turn to COVID-19 now. You, among with other GTHA mayors, have been pushing for vaccine passports for some time. We heard Dr. Kieran Moore just a couple days ago introducing vaccination policies. I don't want to say mandates because it isn't mandatory for some of these high-risk settings like healthcare, like back to school, school settings, to be either vaccinated or to be tested or produce negative test results. Is this far enough for you?
Well, I think that we have to establish the principle that people absolutely must be vaccinated and not pose a risk either to their fellow employees or to the other people they come in contact with, whether that's students or whether that's the public in other ways, or even just their co-workers or their neighbors. And I think that all of the things that have been put forward represent a good start. I think that the proof of vaccine issue shouldn't be a big issue. I mean, the federal government has said they're going to come forward with something digital, and I hope that can be done in such a way as to make it a universally used thing that can be for all purposes. You can get proof of vaccination from the province. I don't even understand really what the big debate is about here. I mean, we just have to take account of the fact that in this case, it is more than about me. Me meaning any individual person. It is about us. It's about the collective good. It's about keeping people healthy. It's about, frankly, keeping the economy open and avoiding the consequences of a surge or a fourth wave that we see happening in the United States to children, for example. I mean, heaven knows we've got to protect our children and keep the schools open, which are scheduled to open in just a couple of weeks' time.
Indeed. Thank you for bringing that up. And just a reminder to our viewers, the change in policy now, and it's available in Toronto as it is in other jurisdictions. Those who were born in 2009, turning 12, can now access that first Pfizer dose and second Pfizer dose, at least get the one before they're going back to school. So that's some good news.
And they can do it, Mel, at our clinics anytime. Yes. Those clinics are open. They don't need an appointment. You can walk up with your 12-year person born in 2009 or later and get that shot. And everybody else that hasn't had one can get one or the second one at the same time.
Very quickly for you. We heard from Masai Ujiri yesterday talking about bringing our Raptors home. Have you been part of some of these discussions?
Yes, I have. I'm delighted he's staying, by the way. I mean, he is not only a great basketball executive, but also one of our leading citizens. So I'm just delighted he's staying here. And we're working on the fact that the present limits that are in place would say only 1,000 people could go to the Scotiabank Arena because it's inside. And so, everybody's taking a look at how all of that can ensure that when the season comes, which is not till October, that we can have our team play at home. Same with the Leafs and the same with a lot of other kinds of indoor activities. So it all depends on, again, people getting vaccinated and things staying safe and rules being put in place. If you think about it for a second, there's not that much risk in a whole bunch of people being in the Scotiabank Arena or a theater if they're all vaccinated. And so if everybody gets vaccinated, that'll make these issues a lot easier to deal with.
And of course, we saw some of the policies rolled out by MLSC, which talk about that in just a moment. Right now, this is our time here, Mayor Tory. We've run out here, but There's so much more. Dina's back. Sid's upstairs.
Uh-oh.
They're ready for you.